Hi all, my name is Dr. Vivek Pal Singh and I am a physician. So I'm here to talk about diabetes reversal. Actually it's a misnomer. Diabetes reversal is probably for marketing tactic, but there is something which we can do to halt the progression of disease, and in some cases we can achieve remission. What do you mean by remission? See, once you leave alcohol, that does not mean that you are not an alcoholic, you are an alcoholic in remission. So similarly, once you are a diabetic, we say that diabetes can go into remission. It does not mean that diabetes is cured. And let me make one thing very clear, that I am not talking about type 1 diabetes wherein a person is insulin dependent. So in no circumstances we are promoting that type 1 diabetes can be cured or can be what we call as that can go into remission. Regarding type 2 diabetes, what is type 2 diabetes? In this, you have accumulated poor lifestyle for so many years wherein body's homeostatic mechanism fails to regulate the upsurge of glucose levels. So what does it mean? That every time you eat, particularly a carbohydrate which is easily digestible, it shoots your blood glucose levels, and to control that blood glucose level, your body secretes insulin. That's a natural way of controlling blood glucose. But in individuals who eat nonsense, who eat too much carbs, who do not exercise, who snack a lot, what happens is there is a continuous state of hyperglycemia or high blood glucose levels. And to keep that in check, body needs to secrete insulin in repeated amounts. What happens is, over years, this high insulin levels causes insulin resistance, because when you have certain chemical in your body or certain hormone in your body which is high in amount, body will try to resist it. So this is a hallmark of development of type 2 diabetes. So what does it mean? People who are having poor lifestyle may be totally euglycemic. What does it mean? That his fasting or postprandial blood glucose or HbA1c will be entirely normal. But if you check their insulin levels, particularly postprandial insulin, that means you eat a meal, check your insulin levels after 2 hours, you will find it to be pretty high, and that's a surrogate marker of impending diabetes. And if you hit well at this stage, you can certainly halt the progression of diabetes without medicines. That's part 1. The part 2 is, once you have already developed type 2 diabetes, that means you need to take some medicines for preventing microvascular and macrovascular complications. However, we have patients, and we have done it very successfully, wherein by intensive lifestyle management, by lifestyle management means personalized coaching for exercise and personalized coaching for nutrition, we can achieve a level of euglycemia wherein the dosage of tablets which the patient is taking is very minimal, and in some cases patients' tablets are entirely stopped. And when sometimes we are using insulin for some reasons in type 2 diabetes wherein the HbA1c is too high, we can definitely ensure that we are getting patients off insulin by our dietary and lifestyle interventions. So that is what is in nutshell regarding what is generally known as diabetes reversal. So it's not exactly diabetes reversal, it is getting your insulin resistance to bare minimum so that the progression to type 2 diabetes is halted. And if you have type 2 diabetes, by certain lifestyle and exercise interventions which are very rigorous, we can temporarily halt the progression and we can ensure euglycemia with minimal use of medications, and certainly we can get patients off insulins.